One of the high moments of our society and at this ceremony is the presentation of the ESC gold medals. They recognize outstanding colleagues, scientists, for their work. So it's time now to present the ESC Gold Medals 2016. And the first ESC Gold Medal is Professor Alain Cribier. Let's see the movie.
Well, the idea of implanting a transcatheter valve came from the disappointing and unsustained results of balloon aortic valvuloplasty, the first technique that was developed by us in Rouen for the treatment of patients with non-surgical aortic stenosis. So came the idea of implanting a valve stent within the diseased aortic valve without removing it, using a regular cardiac catheterization technique. This was made possible by the development of large stent used for peripheral artery disease. So we did a very important autopsy study in Rouen to confirm the concept of valvular stent, together with my colleague Professor Alain, who has been working on my side for the development of this technology until the very first human case. And developing a true valve stent was extremely long and difficult, against the opinion of all experts, saying that it was absolutely impossible to make and clinically irrelevant. But actually, with the development of a startup company that was created with the help of Martin Leon, a very world-famous US cardiologist, and two engineers from the United States, we could obtain the first prototypes of valve stent, and we could start a long period of laboratory work and animal experiment in the sheep. And finally leading to the first in-man case performed in Rouen in April 2002. And it was the beginning of a long story of implantation. Well, on the medical basis, I would say that one of the first advances was probably the opening of intensive care units in the cardiology department starting in the 70s. And associated soon after with the development of new drug therapy and especially thrombolytic therapy, and I was very much involved in the treatment of acute myocardial infarction in France using thrombolysis. I would also focus on the unbelievable progresses of cardiac surgery. Cardiac surgery with the development of coronary artery bypasses and the development of valve replacement. In which my hero in medicine, Alain had an important role, and leading finally to heart transplant and maybe today full cardiac transplantation. To me, the future of TAVI looks really bright, and everyone can be relatively optimistic about the expansion of this procedure in the future. We can be amazed by the considerable expansion of the procedure in high-risk patients and non-surgical candidates. You know that over the last 10 years, the TAVI has been used in more than 300,000 patients in the world, and there is a growing expectancy of 40% in 10 years. So this demonstrates the interest, the potential interest of TAVI for the treatment of calcific aortic stenosis. Now, concerning the expansion to lower risk patients was in the pipeline until the recent years, and we have now the confirmation by the results of Partner 2 trial presented at the last ACC meeting in March that the results of TAVI and surgery are really comparable in intermediate risk patients. So the final question is to know whether TAVI will be further expanded to, I would say, all comers, patients over the age of 65, and we will probably have some kind of results with the Partner 3 trial, which is ongoing, and the same trial ongoing as well with the core valve within 1 or 2 years. The main question will remain the long-term durability of the valve comparatively to surgery, and this will take a little more time to be confirmed.
Please join me in welcoming Professor Cribier. Professor. Congratulations and thank you very much for your outstanding contribution. Let me award you the gold medal of the ESC. It stands and it says, the gold medal is awarded by the European Society of Cardiology to Professor Alain Cribier for his outstanding contribution to the science and practice of cardiology. Well deserved.
Thank you very much again.
You want to say a few words?
Well, believe me, I feel very much honored to receive this prestigious award today, and particularly moved. I know that this is exactly 40 years after my first slide presentation at the European meeting of '76 in Birmingham. It was a long, bumpy road to reach this moment. Well, actually, I just want in 1 minute associate to this award all the members of my teams in Rouen, interventional cardiologists and cardiac surgeons who have been extremely helpful. I want also to express my deepest thanks to the scientific committee and all the people who participated in selecting my name for this gold medal. I am really fascinated by that and very surprised, actually. Also, I just would like to thank my family, my wife, Françoise, and my son, François and Thierry, who amazingly accepted to see me flying away on weekly basis over the last 30 years for conferences, proctoring, and training. So thank you again to all of you.
The diploma. That's good.